Hello everyone, my name is Dr. Simarpreet Singh Anand and today I'll be talking about the basic anatomy related to spinal anesthesia, some of the problems we encounter while performing the block and how to overcome them. So this is a continuation video for the spinal anesthesia video I've already uploaded on my channel. If you have not watched that, do watch it first. So now we'll be learning about some of the basic of anatomy first. So I'm holding a model. So this is the spinous process. This is the laminas, this is the superior articulating process, this is the inferior articulating process, this is the transverse process, and this is the body. In between, from spinal cord is running in through the vertebral foramen. So to perform spinal anesthesia, proper patient positioning is a must. So we give patient a flexed back positioning. Flexing the back opens up the intervertebral spaces. So also increases the target area. So if the patient is not properly positioned or the spine is not flexed, so we can see the needle entrance will be very difficult. I'll show you once again. So if the patient is given proper positioning and the patient back is flexed, needle entrance will be easy. And if the patient is not having a flexed back position, we'll hit bone as soon as we enter the skin. So once we have given a proper position to the patient, we usually palpate the highest point of the iliac crest and palpate the corresponding spine that usually correspond to L4, L5, and it's known as a tertius line. So once we have palpated the space, so we go in between the space and usually perform the subarachnoid block. Now some of the problems which we can face, so some problems are as soon as we insert our needle, we hit the spine. That means we are too far and we are hitting the spinous process. So the trouble, so how we can overcome this is just reinsert the needle and take a proper prick above that. Now second problem which we can face, supposedly we have gone far in and now we are encountering the bone. So the problem here is now we are near the space but we are hitting the lamina. So to overcome this problem, just redirect your needle up or a bit down so that you are in the space. So supposedly I am hitting the lamina here, my needle is too far in. Now I can just move the needle up and just introduce and I can easily find the space.